Well, today I am here with Ben White from Fight CRC. Welcome to the podcast.
Thank you for having me.
You're very welcome. We are going to be talking about some really exciting initiatives that Fight CRC has going on, but the first really big thing we're going to talk about is the Call-on Congress event that's coming up in March. YMyHealth was involved in that last year. We had an incredible experience, and we're going to be going back this year. And so we wanted to talk about that. But first, just want to talk a little bit about you, Ben, how you got involved with Fight CRC and your role with federal policy.
Yeah, so I'm the federal policy manager at Fight CRC. How I got involved? Well, this is not the career I thought I would be in. I graduated undergrad, and I actually joined the Navy. I was a helicopter pilot.
Oh,
Um,
wow.
yeah, um, but I was diagnosed with colon cancer when I was 26. Um, and though I'm now 7 years cancer-free,
Awesome.
my treatment left me with some long-term side effects that meant I was no longer safe in the cockpit, eligible to serve. So I separated from the
Okay.
Navy. And while I was in treatment and around that time after separation was when I found Fight colorectal cancer. So I have been a longtime
Oh,
volunteer and advocate.
awesome.
And at that point, I was kind of looking for a career pivot. So
Or
aside from Fight CRC, I had my undergraduate degree in political science and knew I wanted to pursue an advanced degree in public policy. So I moved to DC, ended up actually working at a different cancer nonprofit while I
interesting.
applied to grad schools and went back to school. And that was about 5 years ago. So I got my master's degree, decided to stay in school forever. Now I'm getting a PhD in health policy. And
Awesome.
I've spent a lot of time in the last few years working at different, cancer nonprofits, health nonprofits. Spent a year writing Medicare regulations. So I have a pretty wide array background over the last few years of things I've dabbled
Yeah.
in. I interned on the Hill. It was very humbling to be a 30-year-old intern. Um,
I
but
love it.
anyway, last summer, the stars kind of aligned and Fight CRC was looking for a new federal policy manager right around the
Awesome.
same time that I was kind of figuring out what was next as far as full-time employment.
Mhm.
And yeah, the stars aligned and it worked out, and it's been incredible to be on the team full-time. And as I mentioned, I was, a long-time volunteer and advocate before joining the team, on a permanent basis. So, it's a very long storied route. I'll try to keep it shorter, but that's kind of how I landed where I am today.
Wow, what an amazing journey to be doing the work that you're doing now and all the different experiences you had. And thank you so much for your service, by the way, as well. And just to bring all of that to Fight CRC's work. I know they're just an incredible organization, and the work you're doing and have been doing in the policy world is just so unbelievably important. So that's really cool to get to hear your background and how you landed here. And kind of, if you could walk us through a little bit before we get into Call-on Congress, kind of what does your role as Fight CRC's federal policy manager entail? And what would you like fellow millennials to know about federal policy? Because I have to tell you, which may not surprise you, a lot of us do not know a lot about it unless we were in the political science, and health policy field.
Right. Well, federal policy is for me, I'm managing all things federal. So both the congressional side of things where we deal with Call-on Congress, but also, tracking what our agencies are doing,
Mm,
Medicare, Health and Human Services, the National Cancer Institute, all that falls under, the federal realm. So, when Medicare makes a new decision that might affect access to care for colorectal cancer screening or patients, that's something that kind of falls under my purview to weigh in on behalf of Fight CRC as well. So kind of a wide array. With Call-on Congress, the focus is obviously our congressional representatives and senators. Something to know,
yeah.
you nailed it. You said a lot of people aren't super aware of what federal policy means. I think there's a lot of apathy and maybe frustration over the divisions in politics and things like that. I think the biggest thing to be aware of is that decisions are being made and work is being done on the Hill all the time.
Mm,
And that's true whether we're there or not. But if you're not at the table, you're on the menu, right? So if we are not a part of the conversations, those decisions are going to be made about us without us being a part of the conversation.
great point.
And so that's why advocacy is incredibly important. And there are, a lot of industries that have dollars to put towards having full-time people on the Hill all the time, making those connections and relationships.
Mm,
And healthcare is not necessarily one of those from the patient perspective, right? It's us. If there
Yeah.
is no like big cancer industry out there lobbying every day, like it's
Yeah.
it's the activists, it's the patients, the caregivers, the families who are affected by this, who have to go and share their stories and share what the priorities are and the things that matter to them. And I also think, Fight CRC is a grassroots advocacy organization, and there is so much power in that, right? Like
Mm.
there's you can send lobbyists all day, but what brings a lot more weight is having a constituent, somebody who lives in the district or the state of a representative or a senator, sharing their story and telling what matters to them, because that's ultimately who those members of Congress are beholden to, right? Like that's who they represent.
Absolutely.
So having, real folks who live in those districts, who live in those states, coming to their members of Congress and sharing priorities and telling what's important to them carries a lot of weight. And so that was a lengthy answer to what millennials should know. But I think the biggest, the short takeaway is that, if we're not at the table, we're on the menu, like I said, and
Yeah.
we need to be at the table. The decisions are being made whether we're there or not, so we should be there.
100%. No, I really appreciate you walking us through all of that because I've learned a lot listening to you already, and I know a lot of other people will too, and people want to get involved. That's really the short of it. A lot of people want to get involved and they don't know how it works and what's going on the Hill, and I think hearing that makes it you know, very relatable, and that actually you can get involved and you should get involved, even if this is not your particular area professionally, that having that, you know, like you said, constituent story is whatever it may be, whether you're a patient, a caregiver, or you're just somebody who wants to advocate for this and a member of our generation. All of us should definitely be at the table, to your point. And when a lot of people are going to be at the table is in March. March 9th through March 11th is Fight CRC's the 2025 Call-on Congress event, which is held in Washington, D.C. And also this year, I think it's considered now, I want to say not Crystal City. They keep changing the name of the area where the event hotel is going to be. What's it?
Yeah,
I'm
it
trying
is
to
actually
think. Is
Crystal
it
City this
Crystal
year.
City
Yeah.
now? That's okay. They're still calling it Crystal City. But yeah, and so it's a really incredible experience. I loved being there for the first time last year. And so I kind of wanted to give people a sense from your perspective and from lots of different perspectives of what, this event can bring to you. So first of all, what should colorectal cancer survivors, which you are one of, and congratulations on 7 years, and current patients know about this incredible event?
Well, first off, thank you for coming last year and thank you for coming again. That
You're
support
so
is huge.
welcome.
Before I dive into that question, I'm going to give a
Yeah,
quick, just like high level overview of what the event is, so
absolutely.
people can kind of get an idea of what to expect. So like you said, March 9th through 11th. March 9th is the very first day. It's our volunteer day. So we have an annual installation called United in Blue, where we place 27,400 flags on the National Mall, blue flags. And these represent all the people who be diagnosed with colorectal cancer before the age of 50 by the year 2030, because early onset colorectal cancer is on the rise. So it's this incredible visual representation that stays up for 2 weeks of the impact of this disease and how it's affecting our generation, younger and younger people. So the 9th is the flag day, where we will actually place all 27,400 of those flags. There's a ton of other pieces of that installation too. You can honor a loved one, up there. So that's a thing you can find on our website. If you want to have a specific tribute to somebody, you can do that as well. And then there's like a mix and mingle that evening for attendees. But anyone can participate who wants to come volunteer. You don't have to like participate in full Call-on Congress, especially folks who are local to the DC area. March 10th is our Hill Day training. So it's kind of a packed full day talking about what we're going to be doing on the Hill. Lots of great presentations, and then also presentations from kind of other educational things that are going on. So we have our folks from CISNET, which is the Cancer Intervention and Surveillance Modeling Network, coming to kind of share some of the work they're doing. And if you're not familiar, CISNET is the group who often does a lot of surveillance and modeling studies. And their modeling study was kind of what was the ultimate piece of evidence that helped guide the lowering of the screening age recommendation from 50 to 45
Oh,
in
awesome.
2021. So they're really the ones who are tracking the data, the incidence data, and trying to project where that's going to be. So we're really excited that some of them are going to come and report. to us on what they're working on. And we also are going to highlight our care report, which I think we'll probably get to a little bit later here, so I won't dive into that too much now. March 10th ends with the rally in the evening, so we all go back out to the mall to the installation. We're hoping to have some of our congressional champions and other partners join us out there, and it's kind of just a big event to showcase what we're doing and the importance of it. And then finally, March 11th is the Hill Day. We have over 250 advocates already registered, but registration is open through January 31st. So we're hoping to get even more folks to come out. And we send all advocates, friends, patients, survivors, caregivers, loved ones out to their members of Congress to talk about issues that are important to colorectal cancer. So that's an overview of kind of what those 3 days actually look like. And you asked, what should survivors, patients, what should people know about it?
Yeah,
So obviously it's an incredible opportunity to advocate for issues that directly affect the colorectal cancer community. But I think in addition to that, it's an incredible opportunity to network with this community. And by network, I mean like
absolutely.
find peer and social support. There is my first call on Congress, it blew me away. There's so much power in being able to sit in a room and not have to explain what you're going through, to be able to talk to somebody who already immediately knows exactly what you're dealing with and has maybe dealt with the same side effects and been on the same medications or supported somebody going through the same thing and dealt with those same, issues of, how to support partners or family members or loved ones. And it's so comforting to have that peer support. And so just
Absolutely.
the opportunity to really meet in person with other folks who know what you're going through is an incredible opportunity.
100%. And I was going to say, just the level of gratitude was one of the things that really stood out to me last year. People were so excited on all the different levels, whether they were meeting somebody, somebody who is currently going through treatment, meeting somebody else who was, or somebody who's a survivor, and survivorship brings its own challenges. And also, even like from the researcher perspective, that was something that was really interesting. Like some of the researchers that came, some of the physicians, like they, you know, as much as they are spending time with people who are in these populations, it's done in such a different setting that it really was an eye opener, I think, for them to hear the stories that they were hearing and the challenges that are being faced and the work that's being done. And in talking with several of them, maybe about a week after the event was over, they all commonly said one thing, that they were so inspired to continue in their work and so motivated, and that of everything that they attend, that this was like the most inspiring event that like gave them that to go, through the next year, to do their work on behalf of patients and survivors. So I think that that's such a testament to this event, for sure.
Absolutely.
For sure. And, what about caregivers? Because that's a totally different perspective. So, as far as caregivers, what would you say kind of is beneficial for them in coming to this event, whether or not they're a caregiver to somebody who is currently in treatment or somebody who is now in survivorship?
I think that's a great question. And I think that a lot of
Thank
the
you.
same things apply. I think it's
Sure.
easy when you look to the cancer space or to any disease space to focus mostly on the patients, but caregivers are such a critical part of our healthcare system, really. Um,
Yeah.
and there are so many, it is easy to overlook that we need to take care of our caregivers as well.
Yeah.
Caregiving involves so much giving and it is exhausting. And it's important to also have those same support networks that the patients and survivors have, to make sure that we're supporting those who are supporting those in treatment. And you kind of nailed the hammer on the head earlier. You said,
Yeah.
it doesn't end with survivorship. And
No.
that is true even of caregiving. A lot of survivors, it doesn't end with being declared no evidence of disease. There are a lot of lifelong issues, whether it's fertility, neuropathy, anxiety, other things like that, that last for a long time. And those will continue to be issues that caregivers will have to, that will likely be impacted by. So the journey, it doesn't end with, a declaration of no evidence of disease. There is kind of a lifelong recovery to come after that. And
Oh,
so, making sure we're supporting everyone all the way through that journey, including caregivers, is critical.
absolutely, 100%. And the last group that I'm thinking about are really people like myself, except I have been in the public health space, right? And I've been in the health advocacy space, but people who are my age and are your age who are not, who are in their 20s, 30s, and 40s, and don't fall into the other categories of being, a colorectal cancer survivor, or patient, or caregiver, but they want to be an advocate, or they simply want to be educated about, what is happening with the health of our generation. How do you see the Con Congress event being for them, as well, for those who are listening, and this is the first time they're hearing about this and are interested.
Yeah, well, first off, thank you. I think it's a pretty selfless thing to advocate on behalf of others when it doesn't directly affect you, and even to be interested in these, the education pieces. It's a little bit selfless, and I think it's worth acknowledging that and thanking people who are there, and thank you.
Thank you very
But I think
much.
the ultimate reality is that if this doesn't directly affect you yet, it probably will.
Yeah.
Colorectal cancer is on the rise in those under 50. In our generation, we're twice as likely to be diagnosed with colorectal cancer as someone born in the 1950s, and unfortunately, unless something changes, even if you don't know somebody who's impacted by colorectal cancer yet, you likely will, and we are out here trying to make changes so that this
Yeah.
doesn't have to be the reality. And we're incredibly grateful for the support of anyone who's willing to join us.
Well, it is why my health's pleasure. It's my personal pleasure to do that. And I think when I think about the the statistics that we've seen, to your point, one in particular being that, here we are, it's 2025 now. We're talking 5 years from now in 2030, where this is going to be, I know I saw recently, the number one cause, of death for people under the age of 50, I believe is what I
Right.
saw.
And
And I was like, whoa, you stop and you say, how can this be? In 2025, we have we have screenings, but there's so many, as we both know, pieces to health insurance coverage of the screenings and other access, barriers to access. So yeah,
yeah, and that stat about colorectal cancer being the number one cancer killer for folks under 50 by
yeah,
2030 already been partially realized. So as of last year, for men, colorectal cancer is the leading cause of cancer death for those under 50, and it is
yeah,
still on track to surpass and become number one for both men and women by 2030.
yeah, yeah. It's just staggering to hear, and why this work is so incredibly important. I know that also this March marks, a very important anniversary for Call on Congress. It'll be 20 years since the event started, and I was curious if there was anything additional planned to specifically celebrate, that 20-year mark. I know there's so many things packed into those couple days already.
Yeah, we are so excited. It's Fight CRC's 20th anniversary. It's actually only our 19th call on Congress, the way the
Oh,
dates work
okay.
out. But we're still, that just means we get to
It's
celebrate
still close.
20 twice in a row because
Yeah,
we'll
that's
celebrate the 20th call
true.
on
That's
Congress
true.
next
That's
year.
true.
But we're really excited. There's going to be a little bit more jubilance is kind of the plan about celebrating the work we've done, highlighting the wins, highlighting the
Yeah.
successes we've had. And as a part of that, we're adding kind of a more of a celebration dinner after Call on Congress. So after we hit the
Nice.
Hill on Tuesday, there's actually going to be a kind of fun, celebration of what we've just accomplished by going to the Hill and what we've accomplished over the last 20 years. In previous years, Call on Congress kind of ended with the visits to the Hill, and a lot of folks would kind of head home after that. We're hoping that folks stay through the end of that day to join us
Yeah.
for that celebration dinner this year.
Oh, that sounds fantastic. And what a great way to end that day, of doing advocacy work on the Hill. Um, I think that Con Congress is, being that it's such a huge event, and really a favorite, with everyone I've spoken to of the colorectal cancer advocacy community. But there's also, I think, what some people don't realize, Fight CRC does a huge amount of other incredibly important work, throughout the year. So I wanted to kind of talk about some of the new things that might be on the horizon, for Fight CRC in 2025, and kind of some updates on different initiatives, that I know, about from last year, that are ongoing too. So the first one, which I thought was really interesting, is y'all have a junior advocacy program, and I did get to meet some of the junior advocates, last year, who are a lot of them in high school. So if you could tell us a little bit about where things are there.
I love our junior advocate program, and particularly as the person responsible for the federal policy management, I think it is such an incredible, for me, in a biased perspective, I see it as a tool for getting the work I need to get done. But it's
Oh,
also,
I'm
it offers
sure.
the same support and same amazing kind of, peer support for those who may have a parent facing colorectal cancer, or a grandparent who want to advocate on behalf of them. But our junior advocate program is incredible. It's year round, but it also has an element at Call-on Congress where we have separate trainings for the junior advocates, and chances for them to meet their peers, and all ages welcome, definitely high schoolers, but there are certainly some younger. I love the junior advocate program. I am lucky enough to have gotten to do Hill visits with the junior advocate in past years,
Oh,
and I will tell
wow.
you there is nothing more powerful than one of those junior advocates telling their lawmaker like it is, or I feel like they can demand things in a way that maybe some of the older advocates might have some hesitancy to,
Sure.
or I've seen the junior advocates be very blunt. Why aren't you doing this thing to support my mom? Why aren't you doing this thing that this would have
Wow.
helped my dad?
Yeah.
And there is a lot of power in that, and I love the program, and there's so much energy behind it. So uh, definitely going to be a part of Call-on Congress this year. Whole families welcome to register. Know that if you're coming as a family, we have programming for the junior advocates that will run alongside by side with the other advocacy training program. So they'll be well looked after. And from what I hear, the junior advocates all come away, already loving the event, and excited to come back year after year. So.
Yeah, no, that's wonderful to hear. It is, I can see it being such a powerful tool because I know even some of the ones that I spoke with last year, like they're going on to doing things in their own schools to bring colorectal cancer education in places where it's currently not, and really needs to be. So yeah, no, they're wonderful. That's fantastic to hear. And what about Colon Club? I know, yeah, there was some last year. They were going to be merging. They put out a lot of really great content online that I've seen and on social media over the years. Um,
The Colon Club is very near and dear to me. It's actually how I got involved with Fight CRC in the first place. It used to be its own standalone nonprofit. And the Colon Club is focused on early onset colorectal cancer, and so it it started initially,
mm,
over 20 years ago. The founder, Molly, was diagnosed very young and was basically told, "You're the only one like this. There's no one like you. You're an anomaly.
mm,
You shouldn't be diagnosed this young." And she said, "I can't be. That can't be right." And she reached out and found other people, and started. It started as kind of an awareness campaign, and what they would do was to get a group of models every year. They call them
mm,
models of survivors and patients, and get them. And it was meant to be a bit, I guess. It was meant to be a thought piece, a little bit
mm.
provocative in a way that, like, they would show off their scars. They would say, "This is what colorectal cancer looks like, and
Wow.
it's affecting people who are young." And so for many years, that was kind of, it evolved over time. It started as a calendar, the colander. And so there were 12
Mm-hmm.
models, and it was meant to be like we could hand these out at doctor's offices and show them that this is a disease
Mm-hmm.
that's affecting young people. And it
That's a
evolved
great
over time,
idea.
and to, a magazine and things like that. And so I was a colon club model, and they introduced me to Fight CRC, and Fight CRC and the Colon Club merged, which I think has been a great thing for the organization to provide some stability to the Colon Club. The mission will
Mm,
continue. It's going to look a little different. I don't think it has looked very different for a long time. There haven't been
yeah.
calendars and things like that, but it's still about raising awareness, and it's back this year. There was kind of, in the year of merging, they took a year off
Mm,
to kind of evaluate how to best run it going forward. But there's going to be a
sure.
colon camp. There's going to be a new set of colon clubbers this year, or who are selected. So to highlight, it's really about highlighting an awareness and education about the early onset piece. So yeah, we're really excited that colon camp is coming back, and that there's going to be kind of a new cohort of colon clubbers.
That's absolutely wonderful to hear because when I found them initially, I thought, the content they provided was so phenomenal, so unusual, and to combine that with the powerhouse that Fight CRC is, you couldn't get anything better than to have those two together, for patients and survivors, and really just to educate across the board. So, I'm very excited to hear that. And also, and there's been a little bit of press about this, the Colorectal Cancer Care Initiative as well. And I was wondering I believe that one is a little bit newer, if I'm not
Yes,
mistaken. It
yeah,
just came
very new.
together shortly. Okay.
So the colorectal cancer care initiative was kind of the brainchild of what began with an early kind of like meeting of the minds that was a part of the um, uh, came out of a meeting at the White House, basically.
Sure.
And, what came out of that was they were able to convene a lot of groups who were thinking about colorectal cancer. And Fight CRC kind of took the initiative to say, well, let's take this momentum and do something with this. We had this big meeting to talk about it, and
Yeah.
we wanted to make sure there was action, and not just, smiles and handshakes, photos and
Yes.
handshakes, excuse me. And so what came of that is kind of a new initiative to look at how are we providing care for colorectal cancer and how can it be improved. And one of the first things that come with that is we can't improve what we're not measuring. And so
Yeah.
in November last year, in 2024, we released the colorectal cancer care report, which was really innovative. We worked with partners across nonprofit, across our pharmaceutical, medical providers, doctors, like really across the entire continuum. Patients,
Mm-hmm.
survivors of who are touched by colorectal cancer had input into this, and the goal is to create a set of measurable outcomes that can be implemented to track how colorectal cancer care is being given and how we can improve it. So they kind of fall under two buckets. We have timely screening. For many years, there has been the 80% in every community that was run
Mm-hmm.
by, I believe, NCCRT, under ACS, which is a great goal and a great starting point. And so we didn't, that goal is still a goal that everyone's shooting for. We haven't reached it across the country. Most who are eligible for screening, it's about 2/3. We're not at that 80%
Mm-hmm.
mark, so still keeping that goal. But the new piece to that is that we're looking to ensure that 80% of patients with abnormal non-invasive screening tests are receiving a follow-up colonoscopy. So if you have a Cologuard or a FIT test or one of those at-home tests, and you get a positive result, you need a colonoscopy to
Yep.
confirm that diagnosis. And so looking to add that second piece to make sure that people aren't just getting lost to the system. The second bucket of goals really falls under, measuring timely diagnosis, treatment, and accurate information. So making sure that 80% of patients are getting biomarker tested when they're diagnosed, that they're getting germline genetic testing, and that they're beginning treatment within 6 weeks of a diagnosis. So it's really this wonderful report. It's available online, and it was this incredible collaborative effort. And the goal is to get this implemented in health systems and hospitals and care settings across the country so that we can start measuring these things and improve them. Because these are real issues that affect, care and screening for patients. And if we're not measuring
Yeah.
them, they're not going to get better.
No, absolutely. And a lot of times, as well, it takes having those numbers, showing that evidence to get the healthcare system to move, to get the funding, all those types of things. So that really hits so many of the most important angles, and honestly, some of which are barriers to getting that
Absolutely.
care. So I was really very excited about the initiative, very excited about the report, and the one other thing, and I know someone had mentioned this to me last year that was really interesting, is how you also have global meetings on research, and I didn't know if there was any new things or any news on that you wanted to share.
So this is a new initiative that we are super, super excited about. But we have been talking about the alarming increase in rates of colorectal cancer in America and how it's going to be the number one killer. But we're not alone in this. It's happening across the world. Across the world, early onset colorectal cancer is killing people sooner and sooner, and we don't know why. And so this is really the first of its kind initiative we're having a think tank this summer in Barcelona to bring researchers from across the globe, from all different countries, um, to start sharing information on this and start sharing what we're finding. Right now, a lot of this work is being done in silos in different countries.
Hmm.
And as you can imagine, I'm sure that means there's probably a lot of duplication and,
Yeah.
repeated efforts. And so we are looking to bring these brilliant people who are looking at this problem in their own countries together to hopefully kind of accelerate the learning on what's going on with this, increase in early onset colorectal cancer. So yeah, we're having a think tank in Barcelona on this summer, that I am incredibly excited
Oh
to see the
yeah.
outcomes of and what comes out of that.
That's just such a brilliant idea. And one thought that just kind of came to mind with that is, so much of the talk here in the US has always been about diet and about obesity. And I have to wonder um, kind of if those are the things, and I'm sure that will be part of the conversation there in Barcelona. Are they seeing that in other countries too, since other countries' diets are so different and have long been, in terms of weight and things like that? I think that could get very, very interesting to discuss as you know researchers and physicians try and figure out why all of this
Yeah.
is going on in our generation. But that's very exciting. I'm very excited to hear what comes from that. And just wondering, because you have so many phenomenal resources to choose from, are there any new colorectal cancer resources or any that are some of your personal favorites that fellow millennials and others should be aware of that Fight CRC offers? And I know they offer a lot.
Yeah, I'll pick just a few because I'll highlight. I mean, they're
Absolutely.
all incredible. A few that I think are particularly easily accessible and relevant.
Yeah.
Our screening quiz. We have a colorectal cancer screening quiz. Should you be screened for colorectal cancer? It is our most used resource on the website. It's very simple quiz. And it tells you whether you should be going to get screened or not. That's the number one. It takes like minutes to fill out. The second is our chatbot. We have this incredible chatbot that you can text it even. It's on our website. But basically, you can ask it anything about colorectal cancer and it'll give you a quick answer. So,
Yeah.
especially if you're looking for a specific answer about, for patients or caregivers looking for, something very niche, rather than have to filter through a list of resources and try and find it, ask our chatbot. It'll pull it right up for you. It might point you to the resource. It'll give you the information. It's really easy to access. And again, there's like a phone number. You can even text it. So
Oh, wow.
really easy to access, particularly as you have like specific questions on colorectal cancer or general.
Yeah.
And the final thing that I think is really exciting is all of our provider resources, right? So
Mm,
colorectal cancer is challenging because it requires a lot of collaboration between our primary care providers who need
yeah.
to refer you to a GI. And so there's a lot of handoff and a lot of education to be done on a lot of fronts. So we have a lot of great provider resources, which we have support in which we can, if a provider wants these resources, we can ship them to them, and we can provide that support without them having to pay for those resources. And we also have advocates who serve as resource champions who we will send these
Wow.
resources to take to providers in their communities. So if you are a provider and you're listening, or if you are interested in being a
Yeah.
resource champion and sharing these resources with providers, I think that's another, the final one I'll highlight. Because again, I could go on and we have, a
Of
whole team that
course.
works on these that's incredible. But those are three of my, I think, like some of my favorites.
Yeah. Oh, and I can see why. And that last one with as far as with the providers, we do have lots of YMyHealth contributors who are providers and listeners. And I think people are always, especially in our age group, are always trying to find resources to help their patients. And so that's wonderful to hear. And I love the idea of having advocates go and take it directly to them too. That is very, very smart for Fight CRC to do. Well, for somebody who, is out there, they want to get involved in colorectal cancer advocacy, they're listening to us and or they know someone who does as well, but they can't come to DC for a call on Congress and they want to get involved. How would you recommend that they get involved in CRC advocacy and being a part of Fight CRC?
So Call-on Congress is an amazing event, but it is also a big lift to fly out to DC and participate in this event for 3 days. And we realize that's not feasible, practical, or maybe something that people are comfortable doing. Not everyone is comfortable going and talking to the lawmakers in person. But advocacy is this year-round effort, and there are so many ways to be involved that don't involve, traveling across the country or, to DC to do it in person. The easiest way is to get on our mailing list. We make it very easy to action on things that are happening. Pretty much monthly, we're having something where you can, basically we make it easy for you. You fill out a form and it sends in to your members of Congress of things that, we're asking to be done or for them to action on. But we're also looking to have opportunities for folks to be able to engage locally. We're planning to have more focus on, hopefully getting advocates out in the districts while the members are on recess this summer, in ways where folks can get involved more at home. And I think a lot of people, especially our generation, don't feel like there's much power in like sending that form and filling in the email, but it does matter.
Mm,
Having that voice and sending that email, and while it feels like a trivial maybe effort, it's not. And that's why it's so easy. Like it doesn't take much effort to be a part of this movement and to make your voice heard. But yeah, I think the short answer is just get on our mailing list.
yeah.
It's easy to be a part of that. Get on our website, fightcrc.org, fightcolorectalcancer.org. and get on the mailing list. You can join our community of champions for those who want to be a bit more engaged. It's our online network where you can, interact with other advocates and, have a little bit more up to date, and maybe more detailed information on what we're working on as opposed to like being on the email mailing list. So, lots of ways to get involved for sure. Obviously I think everyone should come to Call-on Congress because I think it's the best event ever, but I am
Agreed.
realistic and understand that like not everyone can come to Call-on Congress. But that doesn't mean you can't be a part of advocacy at Fight CRC.
Oh, exactly, which is wonderful to hear because I know so many people do want to get involved and they're just trying to find the right way that they can go about it. Because, as you said before, the numbers have continued to rise and it's very much on all of our radar. And so, in this generation, we want to help. We want to help and to educate ourselves. Well, Ben, this was such a wonderful conversation. I am extremely excited about Con Congress, but I'm also extremely excited about all the other things Fight CRC does throughout the year. And we're just so appreciative for your time and for all of your efforts. So thank you so much for joining us.
Thank you so much for having me. And I'm really excited to see you out there in March.
Same here. We're looking forward to it all. Well, thank you so much.